Welcome back to Medical Monday. We are talking about sleep apnea tonight and a remedy for it that may have you going to your dentist. Dr. Leif Swanson is here with me. Thanks for being here once again.
Oh, absolutely.
And I think people just perked up and said, what, to your dentist? This is crazy talk. But it all has to do with this oral appliance. You brought us in an example. If you'll show it once again, hold it up for the camera there. It kind of looks like a retainer, those Invisalign braces that people wear now. It's pretty benign. It's much different than the big CPAP mask that you usually think of when you're talking about sleep apnea. This is very different. How long has this been around?
We've been treating some of the snoring for, I would say 5 to 10 years now, making appliance for that. But it's now become a science, you know, I'm working with a few different companies, but this actually happens to be SomnoMed. And I would say that they've been making these certain appliances for 5 to 7 years.
And obviously there is a need for it. I'm sure you're seeing more and more people come through your door with saying, I got a problem.
Yeah, it's interesting because you know, a lot of these classes that I've been doing for continuing education, a lot of the guys that have been treating it from different countries, like say for instance Australia and Canada, they're like, we've been doing this a lot more than the U.S. has, you know, just because I think it's just not been FDA approved. But it's nice to actually have patients come in and be able to give them an alternative and try to help them get back on that path to where they're actually getting rest and preventing the cascade of effect, you know, with the diseases that are associated or correlated with this.
We've talked about the different types of sleep apnea and who this would be appropriate for and what a sleep study would tell you if you're really a candidate or not. We've also talked about, and I think this is worth reiterating, and not to poo-poo the CPAP at all, because it is necessary for some folks, but it can be detrimental to your romantic relationship. It's just not romantic, and I think anybody would tell you that, to have that in the bedroom or have to wear it every night. This is kind of could be an investment in your relationship, so to speak. Absolutely,
it could be an investment and a good Christmas gift for those guys out there that you know, might be scratching their heads around Black Friday and wondering what they could get their spouse or make their spouse happy. Correct. So I think you know, we have it all the time. It's the spouse that comes in and brings that patient. And then when you get done there treating them, you know, they're like, we're both sleeping better. You know, we're both happy. You know, somebody's waking up and they're not irritated when they wake up because they've not had rest. And so it makes it a win-win for you know, both the spouse or significant other, you know, that has the you know, the sleep apnea. You
told me it costs about $3,000 to $4,000. The good thing is it can be covered under medical insurance, so it can help somebody reach their deductible for sure.
Absolutely.
Which is good. How long do these last?
That's a really good question. So it depends on really the patient, you know, and how much they're wearing it and how much they're actually, because some people, even though they have it in, they still will want to kind of clench and kind of grind with the retainer in, and that will wear it down over time. So it really depends what we're doing. What we're typically seeing on the average is a good 3 to 5 years. So typically, I want to say on average, probably like 5 years.
And how many times over that period are you coming in to say it needs tweaked, it needs adjusted, something's not right?
That's a good question as well. So sometimes, and especially what's nice about having a dentist make this is that, say you have to go in and you have to have a filling done or you have to have a crown done or something like that that has to be restored. Well, that's going to change the fit of the appliance in the mouth. So if you're there or you have your dentist, you know, make this, they can adjust it to make it right to fit for the restoration that you had done.
Gotcha. Dorothy is on the line again. She has a follow-up question. So, Dorothy, welcome back to the show. What's your follow-up for us?
Was I supposed to get my go back to my doctor to recommend me for this? The follow-up is, does I get mucus when I use this machine?
Do you think that are you asking if you think that would be a problem with the appliance?
Yes.
Okay. Okay. I'm going to put you on hold again, Dorothy, so that you can hear the answer here. And we'll give you a second to turn back up your TV so you can listen to the television. I think Dorothy should probably go back to where she started, go back to square one.
Absolutely. If she's having excess mucus and she already has the COPD disease, then absolutely I think she needs to follow up with her doctor. And you know, that might be one of the issues that she feels like she's drowning with the CPAP. So I really think that, you know, following up with her doctor on that and making sure that whatever they got her meds on, and you know, seeing if it's actually helping with her apnea.
And just so, Dorothy, if you didn't catch part of our earlier program here, there are a couple of different kinds of sleep apnea.
Correct.
If you could explain those again, and when this is appropriate, when the oral appliance is appropriate.
So obstructive sleep apnea, you know, that is when we have either too much tissue or lymph, or just, you know,
something you usually see with people who are obese. There's just a lot of neck there.
Correct, a lot of neck there, or you know, there's inflammation in that area. that would cause, so when they lay back, you know, at night and they go to sleep, you know, those muscles will kind of relax and kind of like occlude the airway, so to speak, in the rim architecture. But there's other people that have sleep apnea that have central, and that's more of a neuromuscular issue. So your brain is telling your muscle that it should stay open, but it's actually allowing the muscle to close. So in that area, you know, that's where you do need a device that actually kind of keeps that open when the brain has a neuro dysfunction there.
Sure. And then with people who have tried this oral appliance, what are the drawbacks? When people go, this just isn't working for me, what are the problems? There
are some drawbacks for people that have TMJ, and TMJ is that's basically, or TMD we call it, is a temporomandibular. It's a little joint right there in the jaw. Some of the people that have that, you know, it might exacerbate that. Sometimes it even makes it better because we are pulling that out and allowing the disc that's behind the jaw to kind of give it a rest. So that could be an issue. You know, we have patients that are claustrophobic with the mask and claustrophobic with the appliance as well, and just don't like the pressure it feels with the appliance. And again, you know, I think it's just somebody taking it home and trying to make it work for them, trying to give it a chance, because any of these prostheses are going to take time to get acclimated to.
Sure, it's telling your body to do something differently, which it's hard. Change is hard for all of us. Is there a time or a trial period with this appliance or not?
We typically give people like a week and then see if they need adjustments. And then sometimes it might be we'll give them another week and see if they need to call in. You know, we just kind of play it by ear, and we try to cater it to the individual and not, you know, just try to make it, you know, a certain template. Like, we try to cater to the individual and try to get that to fit and get them some comfort. You know, if it's not working, you know, we're obviously going to try to refund a certain part of it, you know, to help them out. But there's not many cases we've dealt with that we can't get somebody to be compliant with.
And you were telling me, I think earlier, that, you know, I mean, it is a substantial investment, $3,000 to $4,000, just depending on your fitting and everything else. But that cost incorporates what? There are several things.
So the cost incorporates, first of all, we do have the initial cost of the sleep study. If you come through our office, we can offer you the initial sleep study. And the reason we do that is because, say you're not a candidate, but we still have to charge for having the sleep study done, having it read, you know, having the data looked at and printed out. But if, you know, you come in and you are a candidate, you know, it includes, you know, follow-up appointments, it includes the impressions, it includes cleaner, it includes the, you know, obviously the appliance itself, and a container, and also a follow-up sleep study.
Oh, good. And how long do you usually give that follow-up sleep study?
Typically about a year.
And what are the differences that you're seeing for folks?
Well, obviously, I mean, if it's working for them, I mean, we're getting it to where it's even mild or non-existent.
Wow.
So depending on the severity of the case, you know, I think everybody's a little bit different, but definitely making a huge difference.
Wow. I know this isn't the only thing you do in your practice. What else do you do?
Being in a smaller town, I do a little bit of everything.
I'm sure.
we do a lot of you know, just general dentistry, you know, with the typical fillings, and we do, you know, obviously the crowns and the restorative part like that. I do my own implants and extractions with the bone grafts and put the implants in. I do a lot of cosmetic bonding, and what that is I've been training in different places like Scottsdale, Arizona, and Chicago, and doing, like, we're starting to get the composites, which are the white fillings, to almost mimic, you know, what we're seeing in some of the glass, like veneers and you know, crowns that we're doing. So it's been fun, almost making an art out of my profession, you know, with the bonding. So I've really gotten into that a lot lately too. It's
very cool. You mentioned to me that you set up shop in your hometown of Manchester. What interested you in this field to begin with? I pretty much tack it up to dumb luck. Okay, I like your honesty.
Yeah, but obviously God played a big part in it, and you know, it was just something that I really didn't go into college having a plan, and it just all kind of came together and worked out. And it came together and worked out that I got to come back into my hometown, and you know, a place that, like,
you said where you were going as a child.
Raised me as a child, which was probably a tough thing to do. I'm able to kind of give back to our community and you know, help out with you know, not just seeing my patients, but we have charitable organizations that bring in people in, and we get to see them and help them out, and that puts the icing on the cake for it. So
yeah, that's very cool to be able to help back, especially just, you know, in your hometown. There's always something special about being at
it's
home.
neat because my office has just like become a family, and our patients have become like our dental family. So it's a good environment to work in for sure. And
jumping off of that and what your office is like, what should people expect when they call your office?
Well, if you call the Sleep Relief Solutions, you're obviously going to get somebody different than my office. But if you call my office, we have me there and Dr. Hill, and we stay really busy. I mean, it's a smaller town, and there's not a lot of dentists as there are here in Nashville, but I feel like it's a pretty congenial atmosphere. I mean, I have a great staff, and they really care about the people. That way, it's not, you know, a number. You actually feel like you're somebody when you come in, and you know, like, and you know, I advise, you know, the viewers, you know, check out the reviews. I mean, I think they speak for themselves. You know, that is a great place to start when you are looking for a new medical professional, is people will tell you online what they think about that person. Absolutely, that's for sure. Definitely. All right, we're going to take another quick break. If you have a phone call or if you have a question, give us a phone call. 615-737-PLUS is the number to call. We're talking about sleep apnea and an oral appliance that can help remedy it. So again, if you have a question, give us a call. Stay with us.